what does my child need right now is a really big question. The second thing, and I do think it should be brought into the conversation, what are my individual risk factors? Can you share with me like what in this scenario would increase my child's risk? Because I think for me, at least, and with my patients, when I do vaccine consultations, this is something that parents want to know about. So if I feel really hesitant about vaccinations, but I also feel really hesitant about the illness themselves, likely parents are going to want to know, okay, what can I do to minimize my risk of either encountering this illness or the severity of the illness?
All right, hey mama, if you ever felt like vaccine decisions should be more individualized, this is the episode for you. Today, I've got Dr. Ari Calhoun with me, naturopathic doctor. We're going to unpack this growing shift toward more personalized vaccine conversations. Now, the CDC just recently changed childhood immunization schedule, so now it reflects 3 different categories. Vaccines that are recommended for all children, and then vaccines recommended for certain high-risk groups or populations, and then also vaccines based on shared decision making. So we're going to help you understand what that means for your child and what questions to bring to your doctor so you can just feel more prepared and confident as a doctor mom. All right, so Dr. Ari, thank you so much for coming. I know there's so many different changes here. I'm so happy to have you. We're going to help unpack this and explain this to all the parents. So here's my first question for you is that parents are hearing more about this word shared decision making and high risk groups, and they're left feeling like, what does this all mean? Can you help break down what this actually means in like a real life doctor visit?
Well, both of us really love this terminology because medicine in general should be individualized and it should require a shared decision making. And we should be differentiating at-risk groups. And so that's been really lost from how we approach vaccinations. The only type of medical intervention where we apply a blanket schedule and we don't look at the kid in front of us. So I think that it's really intended, although I can't necessarily get in the minds of those who shifted this conversation, but I think the intention is to shift this more towards an individualized schedule, which is something that we've been advocating for such a long period of time. And some children really can benefit from many of these vaccinations and are at higher risk and they tolerate them wonderfully. And then there are other children that are not at high risk. They don't need the same level of support and they might be at higher risk of an adverse reaction. So how do we really break that down? I do think that is where there is some difficulty because there's no guidelines for this and we are all learning and there's not as much data around this as what we would like to be able to kind of separate these two. But there are some foundational ones that I think everyone agrees upon. And so I think that in something that we discuss often with our clients and our patients is something just as simple as something like daycare. Are you putting your child in daycare the first year of life? Are you going to be exposed to other kids, infants on a regular basis where they could be exposed not only to these illnesses, but other illnesses on a regular basis? Or is your child at home? Are they your first child? They're very limited exposure to other kids. And the risk scenario between those two is hugely different. But this comes into other things as well. So we know that children that are breastfed versus not breastfed, that's a huge difference in terms of their risk for a variety of different infectious diseases. And so I think what this invites is a conversation around, is my child at high risk? And something that I think is like really just something, I share with all of my patients and important for parents to consider. When this schedule was put forward, one of the big goals with this schedule was to protect the child that's most vulnerable. And a lot of parents don't have that most vulnerable child. And so the application should change and we should be a little bit more individualized. And so that to me is like, it just opens up that conversation.
Well, I love it because it's so aligned with how we've been teaching for so many years together. So it makes sense to us to look at every child uniquely. And so you brought up some of these risk factors. So when we talk about high risk groups or high risk populations, what are some of the things that parents should be looking at? So you name some things like daycare. You name some things like if they're not breastfed. So what are some of these things that maybe a mom can just look at, like a couple of them, just so she can like check off, oh yeah, my kid's doing this, this, and this, and what that means for her?
Yeah. So I think, again, some of these we have more data than others. And so that's where we kind of as naturopathic doctors would presume that the immune system may respond differently in this scenario or the other. And we can kind of like substantiate that with some evidence, but there's not like the same level of evidence as we have with something like breastfeeding. But obviously malnutrition plays a role. And we're in a westernized world where we're not dealing with the same level of malnutrition as other developing countries. And so by nature, most kids are nourished well, but that's one thing. And I do think, sibling exposure. And so we we see this in terms of like household crowding, but just by the nature of like the more kids in your home, the more things that you're going to be exposed to. I'm sure with you with 4 kids, it's like feels like
Everyone's getting sick. Everyone gets
yes,
sick.
and
Mhm.
bringing something home, and that differs if you don't have other kids in your home. You definitely can rest a little bit easier that you're not going to be exposed to as much in something like cold and flu season. So that's certainly one, the number of household members. Gut microbiome is
Yeah.
so huge and underestimated. And this is something that actually has way more data than we think, but our immune response is dependent on our baseline gut microbiome. And so the bifidobacterium specifically are these really important, we call them keystone species, that really influence how our immune system is going to respond to an immune trigger. So if we don't have adequate levels of bifidobacterium, that could create a more inflammatory response, both in the face of vaccination and in the face of an illness. So that's something that I really advocate for, is just getting a really healthy gut in infancy. Whether we choose to do vaccinations or not, it's really important for a regulated immune response. Beyond that, I think genetics, and this isn't something that everyone has access to, but something that I utilize in my practice to really identify who might be more vulnerable to an invasive infection. So there are certain genetics that maybe the immune system doesn't sense an infection as easily. And so it kind of allows these things to be hidden, which would increase our risk for invasive meningitis with Hib or pneumococcal disease. And then there's even genetics in terms of race and ethnicity. So we know that Native Americans, for instance, have a much higher rate of pneumococcal disease or Hib than those that are white or Caucasian. And so those are some of the risk factors. And again, we could go on, but a lot of the basic ones, are we nourishing? Is our child adequately nourished? Do they have any underlying health conditions co-occurring? What's the state of their microbiome? Are they exposed to breast milk? Is there smoke in the environment? Obviously, that's going to damage the respiratory lining and make it more challenging for them to deal with respiratory illnesses like pertussis. And those are the kind of like some of the basic foundational ones. And then there's some, again, that we can't always control, but it's our exposure to illnesses, which comes through how many people are interacting with us on a daily basis.
Great. So a lot to unpack here. So if a mom's
Mhm.
like listening, they're like, I don't know what to do. I want you to like take like a deep breath. It's going to be okay because each individual child we would just like assess separately. And I think when you go to your doctor to have these discussions, really there's two different areas that we need to look at is what's your child's risk of exposure to the disease
Mhm.
and what's your child's risk for an adverse reaction to getting the vaccine. Those are the two things that I think is part of the shared decision making so that you can maybe have a discussion with your child on what those risks are because there are risks on both sides. And this is where vaccine decision making is so hard on every parent. Some parents come into it and they just know, I don't want to do any vaccines, and they just feel comfortable with the risk that their child may get sick. There's some parents that are so terrified that their child's going to get the disease that they want all
Mhm.
of the vaccines. And then there's a lot of parents that we work with that are like in between and they're hesitant. They're like, do I need them all? Can I just get
Mhm.
some? Can I space them out? And so these are all great things. And please know that you have options for all of that. Okay. One of the big questions I get actually a lot, Dr. Ari, is we started the vaccines with one brand, but now we went to a different doctor and they have a different brand. Could I still continue? Or we started the vaccines and we only did 2 out of the 5, but now we don't want to do anymore. Is there still
Mhm.
some effectiveness? Can you maybe address some of that to share with parents how there actually are options here and we
Mhm.
don't have to always stick to what the CDC schedules exactly per individual child?
Yeah, there's so many options, right? So there's options in how we, which vaccines we get and which vaccines we don't. Then you can go into like, okay, the CDC recommends, 4 or 5 or whatever amount of this vaccination. Do I have to get all doses? And the answer is no, right? And there's different levels of efficacy, but you don't just achieve protection once you get the full series. Like you're gaining protection along the way, and some of that's going to be limited over time. Like there's going to be a waning of immunity, or some of this is building, like you don't reach a more full immunity until you get a number of shots, but there's always choice. So I think just to separate that, no, you don't have to get the full series to gain benefit from a vaccination. And there are some really good examples of that where additional vaccinations don't really improve the efficacy number by all that much. So Hib is one of those, which is, in my opinion, one of like should be our example vaccine. It's really effective and really safe. And so after 2 vaccines, you have 92% of efficacy. And with a third shot or a fourth shot, we don't see much improvement beyond that, maybe 93, 94%, but there's not such a huge jump in efficacy with additional vaccinations. And even something like MMR, for the longest time, we did 1 vaccine, and the second one is still considered a booster, but many adults only have 1 vaccine and still carry great immunity into adulthood. Obviously, there's going to be some waning, but do you need that second booster at 4 or 6 if you're not utilizing it for school? For most kids, no. If you look at their titers, if you look at their antibodies, they have more than adequate immunity, and you could potentially delay that until later when that's starting to wane. So those are just some examples of, even though the schedule is set as for one, number, it doesn't mean that you need to achieve that number to get that response. And then the other question was switching brands. So you can switch brands at any time. Your pediatrician, typically, from a financial standpoint, is not going to carry all the brands out there. They choose the brands they need to carry. These things expire. They're expensive. If they don't use them, they're throwing away the money that they spent to be able to stock them in their clinic. So they're just going to stock what they use, and that's what they use. And so the only difficulty between switching brands is usually it means that you're going to have to switch a provider. But that's another really great way to individualize a vaccine plan, because what we know is not all of the vaccines are created equal. And that doesn't just mean between Tdap and Hib, but that just means for Tdap vaccinations as a whole or DTaP vaccinations as a whole, that you have options there. And some are going to have higher amounts of certain ingredients that may not be tolerated as well. And so we can choose brands that are thought to be and shown to be safer and elicit less side effects. And so that's another great way to individualize your child's vaccine plan.
Yes, I love that. And I love sharing our favorite brands because
Mhm.
there are some that have lower toxicity and are still very effective. So why not choose that if we have
Yeah.
the choice? So that actually kind of brings me to a doctor's visit. So let's say
Yeah.
a mom is about to go to the doctor with their child. What are some questions that a mom can be prepared with to have these conversations? Because I think a lot of doctors just simply don't have time. It's not that they don't care.
Mm.
They don't have time, and they're also taught to follow the CDC schedule. So we have to give as much credit to these doctors as possible. They're doing the best that they can. And yes, some of them are ruthless with it, and some of them are very open to having these conversations. So hopefully you can find a provider that you can have these good conversations and really ask these hard questions and get some answers. So what are some questions that an open-minded doctor can have? What do you recommend some of these moms ask?
I think the best way to create this kind of partnership, because that's what it is, right? Like, we want to be able to open and honestly ask these questions. And when it comes to vaccinations, the first question we should always ask is, which vaccinations are most appropriate for my child right now? And they might answer that as like a blanket statement. So from 2 months of age, these are the most important vaccinations for 2 months of age. And that's still a step forward, right? So we have a whole number of vaccinations at 2 months of age that we're given, but there is a priority list, and your pediatrician should be able to identify these are a priority because exposure is highest, your risk is highest at this age, the likelihood of coming into contact with this is, higher, and be able to explain that. And so a simple kind of example would be, let's just even take, the RSV, which is a monoclonal antibody. It's not necessarily a vaccination, but it's lumped into that. And we say, okay, we're having a baby right now in the summer. It's June and we're having a baby, right? And we're considering these vaccinations, and we have a couple things on the list. So we have hepatitis B. So we'll go beyond that. We'll say we have hepatitis B, we have DTaP, we have polio, we have Hib, we have strep pneumonia, and we have RSV. So these are like 6 different types of immunizations that we have to consider. And so we should automatically be able to say, okay, well, it's not RSV season. Okay. And so even though that your child is most high risk for this illness and being hospitalized from this, the likelihood of them encountering this in the next 3 months is really low. So like that should be one that's like deprioritized on the list, right? And then, there's tons of conversations around hepatitis B, and not that this is the only exposure, but the vast majority of exposure in infants is going to be perinatal from mom to baby. Our kids are not encountering these at-risk behaviors. There's some wacky outliers. By and large, this is not a high risk for our infants. And back when we were getting vaccinations, this was not on the infant schedule. Then we can look at something like polio. Okay, polio is not within the United States circulating for over 40 years. Yes, we've had one case in New York, but by and large, this is not something that's I'm actively concerned about for your child. They're staying within the United States. So then we're able to really whittle it down. And so we say, okay, we have DTaP, we have Hib, we have strep pneumonia, and we have rotavirus. And then we can go through those and determine, okay, which of these makes sense and which of these do we feel comfortable with? So what does my child need right now is a really big question. The second thing, and I do think it should be brought into the conversation, like what are my individual risk factors? Can you share with me like what in this scenario would increase my child's risk? Because I think for me, at least, and with my patients, when I do vaccine consultations, this is something that parents want to know about. So if I feel really hesitant about vaccinations, but I also feel really hesitant about the illness themselves, likely parents are going to want to know, okay, what can I do to minimize my risk of either encountering this illness or the severity of the illness? So what other tools do we have in our toolbox? Like, what would it look like if my kid got pertussis and they were vaccinated? Or what would it look like if my kid got rotavirus? And so we should really understand what these illnesses look like, but also what other tools we can apply. What does treatment look like? Because then once, I think it makes it less scary when we are actually able to walk through that. But two, we as naturopathic doctors are so accustomed to this. Like, I love it because we have so many tools. So we have medication, right? We can use medication, but we have herbs and we have botanicals and we have hydrotherapy and we have homeopathy and we have diet and lifestyle. And so it's like when we approach a particular illness, vaccination is a tool and it has a level of benefit. And some are better than others, but what are our other tools and what else could we lean on? And I think that just takes a lot of the pressure off of the conversation.
Oh my God, I love all of this so much. So
Mm.
going into the doctor, knowing how do we prioritize for where we are now? So don't think about the future. Don't get overwhelmed. Just
Mhm.
stay current and just stay like really focused. And then two, what is the plan? So if your child were to get the infection, do you have a plan and a protocol
Yeah.
that you may feel comfortable with? Because that's the risk. If you don't get the vaccine, they may get the infection. And if they do get the vaccine, they can still get the infection, by the way. So
Mhm.
what are our tools? So that's something that I love sharing in the membership, in our program. Like we have now protocols for pertussis, for measles, for what else do we did?
Varicella,
Yeah,
rotavirus.
varicella, chickenpox, rotavirus,
Yeah.
RSV even. There are
Yeah.
things that we can do with the tools, but this is where I think it's important as a parent to really tune into your anxiety level. I truly believe that if anxiety is overriding you,
Mhm.
you don't want to go to the park with your child. You're so scared of having people over because they're not vaccinated. You're so terrified that they're going to get the disease. In that time, I actually think getting the vaccine is better off because it gives you peace of mind and you can have a life. You can't go to bed so stressed out that your child's going to get sick. And then the other option is you're so terrified that the vaccine is going to cause ill health with your child. You can't sleep at night. You're so worried. You keep on putting off the doctor visit. Then you have to really decide, is that the best thing for your child? So I think, again, this is why it's so individualized for the child, but also for the parents, and their comfortability. Yeah, you're nodding. So you
I just think it's so funny because I share with my patients that like I do a lot of example schedules. So when patients work with me, I'll put together a schedule for them. But I'm not the one who's in the authority of the schedule, the parent is. And I will have two families that have the same exact risk exposures and their
yeah.
interpretation of risk on, their risk benefit ratio on those two sides are weighed differently. And ultimately it should be, it's an individual decision. So one family might feel safer with a schedule that prioritizes protection from the illness. And then one family is going to feel safer with the idea of prioritizing their kind of overall immune neurodevelopment health, minimizing risk in that realm.
Mhm.
And either way, the lovely thing about what we can do here is we can, again, choose to utilize the tool and we can kind of manage risk around that. And so we can start to utilize pre and post support, choosing different vaccinations to minimize some of the potential adverse reactions, or we choose not to use the intervention. And then we really focus on, okay, what is our plan should we encounter this illness? How do we really support the immune system so that it's ready should it encounter this illness? And so we kind of diminish some of the risk around the illness itself. So again, it is, as you mentioned, I say, what keeps you up at night? And then we have to address that because not to say that everyone achieves this like ultimate peace, like there's never a doubt or there's never a concern. That just ultimately is going to happen because if it doesn't, we're not being balanced in this whole situation. There is a risk benefit ratio. Like there are risks on both sides, but we should have ultimate some grounding, some level of peace, and have a plan in place and feel comfortable that we have the support and the tools
Yeah.
should something come up.
Great. Okay. I love this. And this actually goes right into my next question, was about if a family were to choose to vaccinate,
Mhm.
there is support we can offer, right? Before
Mhm.
and after, to help minimize those adverse reactions and also increase effectiveness of the vaccine. Because if you're going to do it, you want it to work. And I just want to give a little background maybe to listeners who don't really know a lot about us. Maybe they're new, but Dr. Ari and I, we actually met in California. We were both California physicians here. And it was when we had all those mandates where all of these kiddos needed, and still to this date when we're recording, are mandated to get a certain number of vaccines in order to enter any school, whether it's public, private, charter, whatever that looks like. So we had a lot of very worried parents who didn't want to give all the vaccines. Maybe they wanted to give some, maybe they wanted to
Mhm.
delay it, but now they're being told you have to do all of these, whatever those were. There were 6 in particular, in order to start at this exact time. So we had less freedom there. So this is where we really came up with this protocol that we don't only help the detox of chemicals and toxins that are in these, but it's actually way more important that we're protecting their immune system. And we're going to go into this area, but I want the parents to understand that if you're distraught, but you're still feeling like, I want to give these vaccines, maybe I want to do only a few, maybe I want to do all of them, there are ways to help support your child through that. And again, if you don't do the vaccines, there are ways to support your child if they were to get the infection. Now, it's not with every illness or every infection, but a lot of them there are. So I just want you guys to like try to get a little bit more peace with that, because there's just so much weight here. And no matter what decision you make, it's a great decision. It's not a right one or a wrong one. It's just the decision. And you can always change your mind over time, but just know you have so many options. And that's why we love sharing. But let's go into this pre and post detox and immune protocol and what it kind of looks like. We don't have to go through every single remedy. It would take too long. But like how we've seen it in practice and why we feel so confident doing this with so many of our patients.
Yeah. I think number one, a little bit what differentiates our program pre and post support from some others that are out there is that no one can argue. The whole intention of a vaccination is to engage in immune response. And unfortunately, eventually we get to antibody production, but that's not the first part of the immune response. So the first part of the immune response is the innate immune response, which is a release of a whole variety of inflammatory molecules. And those have the potential to have this kind of collateral damage, right, for some individuals. And I think that to me and my work in neurodevelopment, this is really important and critical. And I think something that needs further exploration. And if there was a risk, my personal belief is created by the inflammatory response, not necessarily a toxin per se. I don't want to like discount the role of aluminum. Aluminum is huge, but aluminum is in vaccinations to create a more significant inflammatory response. That is the goal of it. So by doing that, we know that we are kind of creating cytokines, inflammatory molecules that have a role in shaping the trajectory of neurodevelopment. So that is my focus as a provider. When I'm looking at how do we diminish risk, I'm looking at how can we create a more regulated immune response. We want a strong immune response. We want an immune response that goes on and creates antibodies, but we don't want a dysregulated, something that is not controlled, that is extra. Okay. In terms of how do we support that, we utilize the wisdom that we have through naturopathic medicine and tons of data, by the way, what we can do to diminish that excess inflammatory response. So something as simple as omega-3s that are in fish oil, which should be part of our kids' regimen anyway, because DHA is critical for that brain development. And we know this, and this is why they make DHA supplementation that babies, infants can take, and they emphasize that moms continue their DHA supplementation through breastfeeding. That is something that is a potent modulator of that inflammatory response. And we can use pre and post support to minimize that risk of an excessive inflammatory response. Another tool that I think is like a little bit separate, definitely we're a huge advocate of, is something like vitamin A. So, with live viral vaccines, essentially we're putting a very weakened form of the virus in the body, and it is replicating just like a virus would. And this is why we don't get side effects immediately. We get side effects 10 days later, 14 days later, because it takes some time for that virus to start replicating and to start eliciting a more significant immune response. And so, something like vitamin A, it works really well in diminishing that replication of the actual virus, but it also helps to get the immune system in gear, create those antibodies earlier so that we're not as likely to elicit a larger inflammatory response from something like the measles virus within MMR. So those are kind of two key tools that we use to kind of modulate an immune response, and so many others. So glutathione is something that I think it's really important to make the distinction that this is not necessarily for detox, but to protect the body from excess oxidative stress. When you give an injection, by nature, you are causing damage to those cells that creates oxidative stress, even if you subtract all the other ingredients in there. But like part of the way that injection is creating an immune response is by creating damage and oxidative free radicals, essentially. And so glutathione kind of also helps to modulate oxidative stress, modulate inflammation. So this is where someone just leading a call for integrative pediatricians and developmental pediatricians on vaccinations. And someone asked me, like, have you ever actually like tracked data on this? And I can say, no, unfortunately, like we don't have strong data to suggest that this is absolutely needed or beneficial. But I can say from my clinical practice and just from the wealth of information that mechanistically it absolutely makes sense, like very clearly makes sense to utilize these nutrients. And then in practice, and I can say you even within our program, we've got such great tolerance of these vaccinations when utilizing this pre and post support. So I see many kids that come to me with vaccine injuries, and in the state of California, they have to continue to vaccinate to go to school. And we've been able to do that with the benefit of utilizing pre and post support, modulating the schedule a bit to increase tolerance. And I think that's a really beautiful thing, because whether you're doing this for school or you're doing this because you want the benefit of the vaccination, everyone hopes to reduce the risk of an adverse reaction. That's like a universal goal. And that's where something like naturopathic medicine can be really supportive.
Wouldn't it be amazing if this was like standard of care? Like with every
Mhm.
vaccine comes like, protocol, and I know we're very far from that, but it doesn't mean that it's unavailable for everyone to utilize, if they want to.
Mhm.
We love sharing that with you guys, but thank you for sharing our approach to it because it makes so much sense to me. And if your child were to get the infection, a lot of these nutrients are going to be very similar because the
Mhm.
infection in of itself is going to cause that cytokine storm and the inflammatory reaction. And we want to protect the brain from all that. So no matter what, knowing this is going to be so important just as a mom to feel confident, right? And informed. So thank you for sharing.
Huh?
Okay. I just want to kind of wrap up by mentioning
Mhm.
I think there's a lot of moms who are nervous and hesitant. I think
Mhm.
we go into doctor's offices sometimes feeling intimidated or sometimes in the worst case scenario bullied, but this is what I'm so like passionate about, helping moms feel more confident with their voice so that they can go in and have a relationship versus just being told what to do, right? Do you have any maybe advice for someone who maybe just walking in that office feeling nervous, maybe has a hard time speaking up? Like, what would you tell her? What kind of things would you just like remind her?
No, I have like such a heart for these moms because I was one of those moms, right? So like we've been through this, and I know you share we were in California, but we were also battling this with our first kids at the time. Like, what do we do with vaccinations? And that's what really perpetuated our interest in our own research. I think that one, it's like there is no right way to do this, right? And if a pediatrician cannot see that you are genuinely just trying to do the best thing for your child and unwilling to have this conversation, then they're not the right person for you. And so if you don't feel, at least that this is an open conversation, they might have different views and that is totally fine. But if it's not an open conversation and they're not willing to listen to some of the concerns, then it's not the right person. Now, I will say that with my patient population, again, I think the more knowledge we have around these illnesses, and I do think in general, the population is becoming so much more informed than where we were 8 years ago, right? You used to mention something like pneumococcal disease or hip or hepatitis B. People had zero idea what that was or how it caused. So I think the access to podcasts and just so much has come out since COVID that in general, our parents are much more informed than they were before. And so I think that information then lends itself to an educated conversation. So I like to kind of share, again, if you're at all considering a vaccination, you go in and ask them about that one, because that's one area where you can connect on and you can kind of say, I've been considering this for these reasons and I'm still working through it, or I'm still kind of debating, but I understand that this is important. And what that does is it allows them to see that you're at least willing to contemplate, right? If you're really hesitant, it shows them that like you've done your research, you understand that there's a benefit. You're still nervous by the risk, but you understand why it's kind of quote unquote standard of care. And so that kind of opens up that conversation. And so if you can kind of come in your thoughts and you can kind of reasonably present, and maybe it is, you could be on the one spectrum and you can say, yep, I come in and I'm like, I'm thinking about these couple. Can you help me with planning it? Or it might be like, I'm hesitant. Like I have this fear. And I do understand. I think acknowledging both the benefits and the risks, that then kind of softens some of the edges of it and allows for there to be conversation. And acknowledging, okay, you know what? Like I understand my child's at risk and these are the steps that I'm choosing to take to diminish it. And so whether that be, I understand I don't want my child to get pertussis in the first 6 months of life. And I really am taking a proactive step by ensuring we minimize some of our social interactions during this time. We're supporting kind of cocooning. We are keeping track of rates and things of that nature. I think that really allows the pediatrician to understand that you're coming into this from a informed standpoint, but also you're applying caution, right? We're not diminishing the risk of all of these illnesses. We're recognizing that we certainly don't want our child to go out and get these things, but yet we're choosing to use some of these other tools. So that's my biggest advice, is just being open-minded yourself. And
Yeah.
recognizing maybe there's something that you haven't heard, and that might shift your mind, but this should be a dialogue.
Okay, I love that. And I think the biggest takeaway that I heard was like, just stay open. You may be like totally anti-vax, but maybe stay open. You may be fully vax, like pro-vax. Just stay open to the possibility that each individual vaccine should be researched for your individual child. And that may change per child, whether it's your first or your fourth, right? We love educating. We love sharing that. Dr. Ari and I, we made a free video for you guys. If you want more information, just go ahead and we'll put the link in the bio. Hopefully we'll keep that updated. And then inside my membership, you guys, I have so much. I've got protocols if the child were to get the disease, but also our pre and post detox immuno protocol, also our favorite brands. There's just so many great things that we love to share, and it should be affordable and easily accessible for you guys. So we're happy to do that. Dr. Ari, thank you so much for your time. You have now come on the podcast, I think, a few times, and I just love our conversation so much. I've always loved working with you and partnering. You really are a gift to the world and with everything. So please go teach more pediatricians, because I feel like the more people know, the more there's going to be access to better doctors and availability. So you're just doing such great work. So thank you.
Well, thank you for having me on. And I always love speaking with you, but also really enjoy being able to speak with parents about this topic and hopefully ease some of that extra anxiety.
That's it. That's exactly what we want. We just want you guys to feel confident and more informed. And it takes time. It takes time. It takes some energy. I know how life is so busy, but like once you get clear, there's so much peace. And again, Dr. Ari and I, we knew this. We were the ones who became really close when we both were pregnant with our first. And even with all of our medical training, we were still like unsure and scared and overwhelmed and confused. So it took us years to kind of uncover this stuff. And that's why we like to make it as easy and simple as possible. Still complex, but as easy to digest as we can. So we love to share. All right, Ari, thank you so much for your time. Okay, have a
Of
great day.
course.